Hey, it's Mo Egger. You've heard me talk about Long Neck Sports Grill for a while. There's no better place to hang out during the summertime than the Long Neck's patio. They've got Northern Kentucky's best wings, an awesome beer selection, 4K TVs. It's a great place. But have you ever thought how cool it would be to have a Long Neck's in your neighborhood? Well, your chance is here. Check out the franchise opportunities by going to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often. Which leads us to something we do on a weekly basis. We're doing it a day late this week because I wasn't here yesterday, but we love having with us the experts from OrthoCincy Orthopedic Sports Medicine. These guys, they have specialists and locations across the tri-state. They offer walk-in orthopedic urgent care, which means you don't need an appointment. Weekdays, 9 a.m. to 9 p.m., Saturdays, 9 a.m. to 1 p.m. Learn more at OrthoCincy.com. That's OrthoCincy.com. Dr. Jonathan Slaughter is with us. It would take me 10 minutes to work through the entire last 2 months as it relates to Christian Encarnacion-Strand, so I'm going to save some time by not doing that. But the original injury, this year at least, came after he was hit in a game that was played 2 months ago today, April 27th. He's going to finally have surgery on July the 11th. Explain to me how and why.
So his story is interesting because it was initial hit by pitch, old or subacute fracture seen. Then MRI started to come back, have more pain. Then, actually, he does have an ulnar styloid fracture, 6 to 8 weeks. Apparently cleared by red staff, but I'm guessing that he was still having some discomfort or pain, sought a second opinion. Now there's ligament damage, and now there's surgery. So it's a complex story of like, well, how did all this come about? What took so long? And it's hard because without truly seeing MRIs, imaging, examining him, knowing exactly what the diagnosis is, it can be difficult. But my guess with him, hearing ligament damage, especially with a known ulnar styloid fracture. So again, on the small finger side of your wrist, it's that long bone that goes from the elbow to the wrist, and you can feel a little bump on that small finger side right at your wrist. That's your ulnar styloid. What attaches to that ulnar styloid is a disc of cartilage called your triangular fibrocartilage complex, or the TFCC. It almost acts like a meniscus of the wrist. My guess, without knowing the true diagnosis, is that's probably the ligament that is torn, the TFCC. That ligament can help provide stability between the two long bones of your forearm, the radius and the ulna. And if he was still symptomatic, having pain, and an MRI showed tearing of that disc of cartilage, my guess is that's likely what's going to be repaired. Especially if he's having any subtle instability or some increased movement between the two bones, the radius and the ulna at the wrist.
So the procedure will take place July the 11th. What we have read and what we have heard is 3-month recovery. That obviously pretty much kills the rest of his season, which stinks on 1,000 different levels. So kind of walk me through the timeline, and will it end with him being able to go for the beginning of spring training in 2025?
Yeah, so if it is that TFCC, that disc of cartilage, and if it is repairable, because it's like a meniscus, not all meniscus tears in a knee are repairable. Sometimes you just have to debride them. But if his tear is more on the edge or the periphery of that TFCC, it is repairable. So then you go and you repair it, attach it back down to the ulna or where it's torn off of. And then you immobilize the wrist, including trying to limit rotation of the wrist for the first 6 weeks to get initial healing. Then at the 6-week mark, I initiate range of motion with therapy, just getting range of motion back, so that when you're getting to the 10 to 12 week or the 3-month mark, now you're working on the strengthening and starting to resume more normal type activities with the wrist. And again, that's if the ligament that he's having repaired is that TFCC. I doubt it's one of the bigger ligaments like a Joe Burrow with a scapholunate ligament or a lunotriquetral ligament, which there's many other ligaments. But my guess, especially with an ulnar styloid, is that it's that TFCC.
Let's talk about TJ Friedl. And unfortunately, in my conversations with many of your colleagues, he has been a frequent topic and is back on the injured list again with a hamstring strain. What's interesting is he originally suffered the injury in the game against the Pirates last week, made a great catch, and then he sits for a day, comes back and plays, and then they ultimately determine, let's go ahead and put him on the IL. How much risk did they run by having him play a couple of games while he was dealing with this?
It depends on how bad his initial strain or tear of the hamstring was. Most likely it was a low-grade, just partial pull or very minimal tearing of the hamstring. And so anytime you have an injury to a muscle, you're going to be at increased risk of further injury if you play. But you're talking about professional athletes that are playing 162 games in baseball. By this time of the year, I'd say most athletes are having some sort of aches and pains of going through the rigors of the season. And so putting him necessarily at risk for further injury, I would say, especially with how depleted the Reds are right now, most doctors, if it was a minor strain, would say, yeah, you could potentially make this worse, but it was actually hot out, which is actually can be sometimes preventative of muscle pulls. It's more the cold that we worry about with muscle injuries. I think it would probably be reasonable if it was a very mild strain of a hamstring to let him try.
All right, so you kind of referenced something that I was going to ask about next. It hasn't just been hot. I mean, for a while it was unreal. But that's conducive to being able to bounce back from something like this, because you hear all the time about cramps in extreme heat. That's not something you worry about with something like this in the weather?
So just a strain, no. The cramps you worry about more due to dehydration, lack of fluid intake, and electrolytes from how much you're constantly sweating in heat. So in heat, you worry more about heat exhaustion, dehydration, which can lead to cramps of muscle. And you see, especially in like soccer players, football players going down, stretching out due to more fluid loss, not a true muscle pull. When you have tight or strain of a muscle, heat can actually be more protective because it's easier to stretch out and keep the muscles loose, which can be protective.
Let's talk about a pair of FC Cincinnati players, Matt Miazga. Those who follow that team know how important he is to their fortunes. His season is over. He has undergone surgery for a PCL and meniscus tear. The injury originally suffered a couple of weeks ago, and sort of felt like from the get-go he was taken off on a stretcher. This wasn't going to be good. So walk me through this injury. What's he dealing with?
Yeah, so a PCL injury, so the posterior cruciate ligament is a ligament in the back of the knee that helps protect against your shin translating or moving backwards on your thigh bone or your femur. Isolated PCL injuries are not near as common as like an ACL, which we hear about all the time. But usually it's a dashboard type injury is what we call, where the knee is flexed and it takes a direct blow, causing a shift of the shin bone on the femur or thigh bone. And that's exactly what you saw when he did that slide tackle trying to save the cross or the goal, which he did. His knee was flexed and his shin went right into the goal post, creating that dashboard type injury. He then sought an opinion with medical treatment with doctors in New York City, and they proceeded with a posterior cruciate ligament reconstruction and meniscus repair. So,
had the procedure. Obviously, he's not going to play this season. Are we talking about something that could jeopardize the beginning of 2025?
Yeah, and I even talked with some of my sports docs that, anytime you have an injury like this that involves some of the major ligaments of the knee, you really are looking at potential 9 months full recovery. So it would put the initial start of the season in jeopardy, but he is also high-level athlete working with some of the top specialists, top rehab, top trainers. So he's going to get exceptional rehab that will make it possible to come back at the beginning of the season.
One more to talk about. Dr. Jonathan Slaughter from OrthoCincy is with us. Nick Hagglund, local kid, another kid on that back line for FC Cincinnati, is dealing with a broken fibula. He was carried off the field on a stretcher, and they're lost to New England last week. Let's start with that body part, the fibula. We hear about it. I think sometimes we hear about that particular body part, and we're not necessarily certain what it is. What is a fibula?
So the fibula, it's one of your, in your shin, you have two long bones in your shin. You've got your big one, which is your tibia. That's your main weight-bearing bone. And then you have a smaller, skinnier bone on the outside of your leg called the fibula. It goes from the knee down to the ankle and helps make up part of your ankle joint.
What's kind of interesting about this, the first thing that jumped to mind to me was there are NFL players who have played in football games through fibula fractures. I think Alex Mack, Cole Beasley, those two players come to mind. Mack in the Super Bowl. How is that possible?
It all depends on where the fracture is in the fibula. The most common fibula fractures that we see as orthopedic surgeons are down at the ankle. Usually you roll your ankle in, you break the fibula down near the ankle, and depending on even there, it could be just a small little tip of the very end of the bone where the ligaments attach, pulls a fleck of bone off, which then acts more like a really bad low ankle sprain you could play through. The higher up you go in the ankle makes it less likely to be able to play on it, the more likely for some instability of the ankle that would require surgery. Or sometimes you can even break it right from like a direct blow in the mid shaft, so right in the middle of the leg or even up closer to the knee. Those typically, as long as it's not a twisting injury that disrupts the ligament that connects the two main bones of the leg, can be treated with partial weight bearing or even full protected weight bearing, which could potentially allow you to play through.
So what's the treatment here, and should we expect him to return in time for the beginning of next season?
With a typical fibula fracture, I would have I would very much expect him to be back next year, not knowing exactly where he broke it, but from everything. And FC Cincinnati is very good about being tight-lipped and not letting things slip out. Not knowing exactly where it is, if it's a low fibula fracture, let it heal, protected weight bearing. Even maybe the into August potentially returning to play. If it's higher up, I haven't heard anything that this is going to require surgery, so I don't think it's an unstable ankle fracture. I think it's a stable ankle fracture, going to be more lower down and likely going to be treated either in a cast or a boot, protected weight bearing, get initial healing, start increasing weight bearing, start working with rehab therapy, increasing strength. So from everything I see, I would be surprised if he's not back at the beginning of next year.
A lot to discuss, a lot to sift through, a lot to pay attention to. You always provide such great perspective. We'll do it again, man. Thank you so much.
I appreciate it, Mo. Thank you.
Thank you. That's Dr. Jonathan Slaughter from OrthoCincy.com. The great thing about OrthoCincy is they have specialists and locations all over the tri-state. That includes walk-in orthopedic urgent care, weekdays 9 a.m. to 9 p.m., and on Saturdays 9 a.m. to 1 p.m. at both Edgewood and Anderson. It's easier, and it goes without saying, it's cheaper than going to an ER whenever you have an urgent orthopedic injury. Go to OrthoCincy.com. That's OrthoCincy.com. Hey, it's Mo Egger. Summertime means warm nights on the outdoor patio at Long Neck Sports Grill. They've got 4K TVs outside, so you don't have to miss a game. Awesome wings, Northern Kentucky's best beer selection, great service, 3 terrific locations in Northern Kentucky, and maybe you could have a Long Necks in your neighborhood. Your chance is here. Go to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often.